Nosso segundo dia do 28º Congresso Brasileiro de Nutrologia está se encerrando. E aqui no estúdio do podcast ABRAN, a gente recebeu ao longo do dia várias visitas importantes e você vai conferir toda essa programação no canal da ABRAN do YouTube. E hoje a gente encerra o nosso dia de uma maneira muito especial. Como você sabe, o CBN 2024 traz para você, congressista, traz para você que nos assiste também, muitos profissionais, palestrantes, pesquisadores e cientistas de várias partes do mundo. E agora nós temos a alegria de receber o Dr. Kenneth Christopher. Ele é professor assistente da Faculdade de Medicina de Harvard, nos Estados Unidos, e dentre muitas outras coisas que estão incluídas no seu vasto e bem pomposo resumê o currículo, e está também que ele faz frequentes palestras e conferências ao redor do mundo. Dr. Christopher, seja bem-vindo. É uma alegria tê-lo conosco.
Thank you very much. Obrigado.
Doutor, olha só, muito bom. Doutor, levando em conta que a nutrologia faz interface com todas as áreas médicas, que temáticas, na sua opinião, devem ser consideradas ou abordadas em congressos do tamanho e da importância do Congresso Brasileiro de Nutrologia?
So I think that the awareness of the word nutrology beyond Brazil is important in terms of allowing other people outside of the country to understand what the field is. Nutrology is a term that I hadn't heard before I met Simone, my colleague now, who's one of my associate editors at the journal that I run, JPEN. So I hadn't heard that term before. And so I think that it's important to allow the world to understand what nutrology is. In terms of things to focus on during the conference, I'm a big proponent of learning how to do research and helping people understand how to interpret research studies and maybe inspire people to pursue research in nutrition, in nutrology, etc. So that's something that I think can be developed as the conferences go forward. I've brought in my own research agenda, and the actual data that we presented was it's in development. It's not published. So I brought brand new data that I'm collaborating with my colleague Simone Silvestre, and I brought that here for the first time. Hasn't been presented anywhere in the world.
Oh, so
I
good.
think that presenting data and having scientific sessions could be an important room for growth for the conference, because I think it will attract people who then can inspire some of the younger investigators and younger trainees to pursue a career that balances clinical as well as research scholarship.
Bom, deixa eu só fazer um adendo aqui, que o doutor está aqui conosco e nós contamos mais uma vez com a ajuda do Renato. Renato, que é tradutor, está aqui fazendo as vezes de traduzir as minhas perguntas, as minhas falas ao Dr. Christopher. E as falas do Dr. Christopher, para você que nos assiste, estão ali legendadas para que não haja nenhum tipo de dúvida de você não compreender aqui. Então, mais uma vez ao Renato, a nossa gratidão pelo apoio aqui. E eu não perguntei ao doutor o que o senhor achou da participação no Congresso de 2024. Quais são as suas impressões para o Congresso Brasileiro de Nutrologia?
So this is my third time at ABRAN, and I think that I tell my colleagues and my friends that this is the most fun I ever have at a meeting anywhere in the world. I meet young colleagues who are very excited about the field, who are very excited about doing publishing, about writing papers. And I think that is exciting to me, because as a journal editor, I see a lot of papers from Brazil. And I know that there's a lot of active investigators here. And so I think I've been inspired by being here, by meeting relatively young investigators who are starting out and helping them understand their particular path and certain things they can do to increase the likelihood that their papers would get published and what to do over the course of the next 5 to 10 years in their career to, again, develop themselves as researchers.
Oh, thank you. Agora eu gostaria de saber sobre o tema abordado aqui na palestra. Ele falou sobre quem sobreviverá à UTI e precisará de reabilitação, ou seria quem sobreviverá à UTI precisa de reabilitação?
So the talk that I did today was looking at metabolites that were collected during a clinical trial. Clinical trial was published in 2018 in JAMA, and I obtained funding from the National Institutes of Health to study the plasma samples that were collected during that trial. And what we did was we looked at about 1,000 metabolites in each sample. In these metabolites, some of them are commonly known, but many of them are identifiable, but not readily understood by most people. And what we did, Simone Silvestre and I, we decided to look at something called the acetylome, which is a marker of protein breakdown, probably in the muscle, that then gets transported to the circulation. So every protein, or 85% of protein that's in muscle, has a marker at the end of it. So it's called an N-acetylation. So that piece of it then breaks up, enters into the bloodstream, and what we're looking for is a signal that could predict how patients will do 6 months later. So for some of those patients, they don't survive, so they're not in our analysis. So we looked at patients who survived an ICU stay up to 6 months. So they had to survive for a whole 6 months. So about half of the cohort in the trial survived to 6 months. And those patients were given a survey in terms of how they understood and viewed their own physical function. So were they able to do their activities of daily living at their normal level? And so what that gave us was a sense of how impaired they were functionally. And going back to their first week in the intensive care unit, we know that muscle breakdown happens, but we are looking at these metabolites for specific markers, it's called the acetylome, to predict which patients are going to be weaker than others or have functional dysfunction or physical dysfunction at 6 months, even though they survived. So looking at this signal really early on might help us predict who needs more services going forward, and maybe even who needs better nutrition because they've lost so much muscle.
E essa descoberta, esse estudo que ele acompanhou, né, que levou ele a estes números, dão agora que norte para essa reabilitação pós-tratamento de UTI?
So the studies that I do are hypothesis generating, they're exploratory, they're examining the data in a very new way to try to promote discovery that will allow other researchers to focus in on perhaps these metabolites to potentially be biomarkers that could be used even at the bedside. So the techniques that I use in terms of analyzing the plasma to identify the metabolites, those are done like on industrial scale. It's not something that you can do in the hospital. So there isn't much in the way that you can do with this information right now to change practice. But if what we have found is corroborated by others and then simplified into something that we call a point of care test that we can do at the bedside, that gives us information that we cannot obtain in like a normal blood sample that's done in the hospital or even a normal evaluation. This is an in-depth look at what's happening in the muscle, but looking at the actual circulation. So we're getting an idea of how much muscle breakdown is actually happening, and that might be able to help us predict what's going to happen to those patients long term. And perhaps they might need a more intense physical therapy regimen or a more intense nutrition regimen, or perhaps they're so sick from their original illness, this is another marker of illness severity. And because they're so sick, maybe they will have a harder recovery.
Yes. E então vamos lá para a última pergunta. A gente queria saber, ele trouxe muito conhecimento, todo esse trabalho dele sendo distribuído, sendo dividido conosco. Nós gostaríamos de saber o que ele leva do Brasil e do Congresso para os Estados Unidos.
Well, I, as a journal editor, I see, as I said, studies from Brazil. And I know that many of the studies that I receive are high quality because the population is very large. The infrastructure for research is already present. The data collection in general is very well done. And it gives me a lot of confidence when I see a manuscript from Brazil that it has potential to be good. It has potential to even be better. And my relationship with people here, and my relationship with the authors is very mutually respectful, because I will ask them to do things and they will see it as being constructive rather than being difficult. And because I have personal relationships with a lot of people here in Brazil, I understand them more than I would someone from another part of the world that I've never visited. So that understanding allows me to be very particular in terms of what I want them to do, because I know that they'll respond in a kind way because they see it as constructive. They don't see my demands as being difficult. But I think that's because I understand the culture to a point. And this is my third visit to Sao Paulo. I can't say I understand the culture, but I understand it a lot better than I did before. And I think the potential of Brazil to be a major clinical research powerhouse is there because there's a lot of smart people here, there's a lot of patients, and there's a lot of already established infrastructure. In my impression, I think that Brazil needs what every country needs in terms of clinical research. They need clinical research training. It's not something that you get at a high enough level in general, and people have to seek it out. But I know from training a lot of individuals and teaching clinical research methods around the world that people can really improve with structured education in clinical research that is practical, that allows them to learn how to do things and learn skills, not just learn theory. Theory is very important, but if you can do stuff, if you can program, and if you can study design, then you can create papers that almost automatically get accepted, right? So I think that that's where there's room to grow, and that's common all throughout the world. It's even common in the United States. But I think that because of the character of the researchers that I meet here, I know that what they're producing is honest, and I know it has potential to be high level, especially with a little constructive criticism.
Oh, so good. Muito obrigada.
Mucho obrigado.
I see you in 2025.
I hope so. If Dr. Duvall asks me, which he has to. No, of course, I will be here. Absolutely.
Thank you so much.